Average temperatures are falling, average COVID case numbers are rising, and the Omicron variant has arrived in Massachusetts just as we knew it would. And as I'm sure you've heard, a fully vaccinated woman in her 20s from Middlesex County was declared the first known case over the weekend. So what exactly does that mean, practically speaking? We're still waiting to find out. But city and state leaders agree on one thing for sure.
My first message to people would be to get vaccinated.
I urge Bostonians to get tested, to get vaccinated, to get boosted, and to work with us to close these gaps.
To that end, Governor Baker and Boston Mayor Wu are both working to expand access to vaccines and boosters. Then this morning, the head of the mayor's newly formed COVID-19 advisory committee, Dr. Bisola Ojikutu, announced that the city would not only be offering additional vaccine clinics, but 20,000 free rapid antigen home tests and free masks. Dr. Ojikutu is also executive director of the Boston Public Health Commission, joins me now, along with another member of that advisory group, Dr. Cassandra Pierre, medical director of public health programs at Boston Medical Center. Doctors, it's good to see you both. Thank you so much for being here.
Thanks for having me.
Dr. Ojikutu, can I start with you? Are you confident that what was announced today by you and the mayor is enough to stay ahead of the Omicron variant and to keep pace with rising case numbers here?
So I think that there are a lot of unknowns right now as far as Omicron is concerned. And I think that there are also some unknowns in regards to this anticipated winter surge. So all that we can do is really utilize the tools that we know we have at our disposal and decrease barriers and access to them. And that's what we're trying to do. So one of the strategies, obviously, is going to be to increase testing. So this is the 20,000 home rapid testing kits that we have purchased and will be distributing, particularly in our most vulnerable communities.
But staying on that just for a second, Dr. Ojikutu, as you know, places like New Hampshire offered free tests to everybody in the state, even though they ultimately ran out pretty quickly. The UK is offering free tests to everybody. 20,000 is a wonderful start, particularly for those most vulnerable, but shouldn't everybody in Boston have access to a free rapid test?
Absolutely. And I have, I don't think anybody would argue with that point. I mean, everyone should have access to COVID-19 testing. The issue is that we wanted to start with this 20,000 and we have the ability to scale up from there, and we plan to. In some communities, folks are not using these home rapid tests, and I think that they are a reasonable mitigation strategy that can be very useful, particularly in the holiday season when people are gathering. People can, test themselves in advance, and it gives you knowledge, and you can use that knowledge to, understand your risk and, not engage in activities that would put others at risk. That's what's important.
Dr. Pierre, staying on these tests for a minute, it seems to me that while the President of the United States is well-intentioned, his proposal is completely unworkable. The notion that people with private insurance will pay up front the $25 or whatever it is for 2 tests, then submit it with all the forms to their insurance company. Uninsured people, and we don't have quite as many in Massachusetts, theoretically through community health centers, even though Michael Curry, who runs them today, said told us on the radio, he didn't know exactly how it was going to work. Shouldn't the United States be doing the exact same thing Dr. Ojikutu and I discussed, providing free tests for everybody?
I think what the country, or what Biden has proposed, again, is a start, but I agree that it is going to be cumbersome, especially for communities that have already experienced gaps in access to tests and testing sites. I think having these readily available and in hand without the costs that we've talked about that have been prohibitive in many communities would go a long way into making the strategy of expanding testing actionable. I think it is a start. And I'm hoping that the amount of tests would be scaled up and that in many communities, as has already been posited, these tests will be distributed for free. And that is actually one of the points of the national strategy, is that those tests will be distributed at certain community health centers and other mobile sites. But we need a lot more of that.
Dr. Ojikutu, I want to return to Boston if I can for a minute. Even with a much lower positivity rate than we have here in New York City, it's 2.8% as opposed to, I think you said today, 5.2. Mayor de Blasio made this statement today about vaccine mandates for all employers. Here he is.
It is time. Look, this is how we put health and safety first, by ensuring that there is a vaccine mandate that reaches everyone universally in the private sector. A lot of folks in the private sector have said to me they believe in vaccination, but they're not quite sure how they can do it themselves. Well, we're going to do it.
And Dr. Ojikutu, that was today. As you know, for quite a while, New York City has said if you go into a restaurant or a performance venue, you have to be vaccinated. We asked on the radio candidate Wu a week before the election if she supported that in Boston. She said yes, she did. When we asked her that question a week after she was elected, here was her response.
We're looking internally as well as externally at all of the options available, working in close conjunction with Dr. Ojikutu and the Public Health Commission on what those standards will look like, and to do so in a way that would, again, not put the burden on our small business owners and organizational leaders, but really ensure that the public health infrastructure is doing that work.
Why shouldn't we be doing what New York City is doing, Dr. Ojikutu?
So I think that here in Boston, in working with Mayor Wu, really we're looking at all the strategies. Nothing is off the table. I think that one of the important pieces to this is really having some robust discussion with experts in the field. And that is why this COVID-19 advisory group was started, which is a very diverse, multidisciplinary group, including Dr. Pierre, who's here, as well as other experts in infectious diseases, businesses, other civic leaders, community-based organization leaders. And these are the people who we want to weigh in. You know, this is our community, and we should be a part of making these decisions.
So both of those could be possible in the future, you're saying?
I do agree that both of those could be possible in the future. Again, I don't think that anything is off the table. We want to do what's best to keep our residents.
Dr. Pierre, can we just talk about one of those for a minute? It seems I am stunned by how few restaurants, for example, have a vaccine mandate. And the restaurateurs with whom we've spoken, primarily on our radio show, who haven't imposed the mandate, have said, you know, there's an unlevel playing field. Wouldn't it make it easier for every one of those small businesses, as Mayor Wu mentioned, restaurants in this case, wouldn't it make it easier for them if everybody operated on the same set of rules and every restaurant had to look at people's card to know that they were vaccinated? Wouldn't that be safer and easier?
Well, safer potentially. Easier, you know, I think it certainly helps if there is some kind of guidance in place. But there are other downstream effects in asking small businesses to take on the burden of checking. How does that look? What is the strategy for ensuring that people have truly been vaccinated? I certainly think that, you know, guidance is in place, for example, with masks, allows businesses to, for example, request that people come into their store with masks and not have to engage in confrontation or back and forth discussion. But I think the logistics of putting this in place and mandating it, I think it can look very different. And so I think it is something that is still, you know, we're still looking for standards or people are still looking for standards for this.
From what I hear, it's working pretty smoothly in New York. You know, one last thing that was said today, Dr. Ojikutu, that was really frightening. I think on the state level, the disparity, the racial disparity in terms of vaccinations amongst adults is diminishing. The numbers are coming closer. The numbers that you guys released today about kids 5 to 11, you said a quarter of them were vaccinated. I understand it's fairly early in the process. 57% of white kids are in that quarter, only 10% of Latino children, and only 8% of black kids. What's the strategy to level up those frightening numbers?
Well, it's a multi-tiered strategy. And I have to start, though, by saying that I am also disturbed by those figures, that those disparities are quite stark. First, what we want to do is we need to do some education and some community outreach and some trust building in our communities. This is really this similar process that what we did with adolescent and adult vaccinations. That's working with our vaccine equity grant recipients. We have community-based organizations that have been funded to do this boots on the ground work. They know their communities. That's number one. Number two is working with the Boston public school system and making sure that vaccines are available through our community partners at schools, so it's convenient for children even, and then it's also about having more community-based sites available. I mean, not every parent can take their child to get a vaccine during business hours. Make sites available on Saturdays. We need to dispel fears. We need to build trust, and we need to increase access.
Before you go, Dr. Pierre, first with you, and then Dr. Ojikutu for you. How worried are you about the new variant? And I know that most people are parroting the president's line, cause for concern, not panic. But how concerned are you?
Well, I think, we know that Omicron is here. And so we're waiting to hear more information about how pervasive it is, what the trend for transmission looks like. We know that we're starting at a higher level of infection due to the Delta surge in the summer. And as we move indoors with now two potentially transmissible, highly transmissible variants, it is certainly a concern, but we're in a different place than we were last year, of course, with vaccinations, with the options of boosters. I would say my concern remains as it was in the summer of Delta for those who are unvaccinated and, of course, for children who are unvaccinated, disproportionately unvaccinated, and also those who are not yet eligible.
Dr. Ojikutu, what's your take on Omicron early on?
So I am definitely concerned. I think that any, reasonable researcher, scientist, public health professional would be concerned when faced with a variant that has as many mutations as this particular variant does involving the spike protein, something, that is concerning that we are very worried about in terms of transmission, as well as not knowing vaccine efficacy in light of this, or severity, really, even though there have been some smaller reports. But I think what I'm most concerned about is the future. If we don't vaccinate the world, this is going to continue to happen. So that is really what, I think we need to be focused in on, because I think our infrastructure will handle what's going on right now. I mean, that's my hope. And that we will be okay with these mitigation strategies that we've discussed. But we're not going to be okay long term if we continue to have people unvaccinated throughout our globe. And this is going to continue to happen.
Couldn't agree more. Dr. Ojikutu, Dr. Pierre, thank you so much for your time. I appreciate it.